So the Christ Hospital Network, it is hosting a free webinar on women's health, and joining us in studio to talk about it is Dr. Janice Rafferty. Okay, Dr. Rafferty, I'm so curious about this. I want to just dive right in to this webinar because it's kind of based on the fact that you guys have already gotten such amazing responsive. Women in this community have been so receptive to really the information that you're able to bring them via webinar. Tell us a little bit about tomorrow's.
So tomorrow we have a panel of women physicians speaking about women's health, covering all of the ages. You know, whether you're 20 or whether you're 80, there's going to be someone in this webinar that will catch your eye and catch your interest. We've got OB-GYNs, we've got cardiology, we've got primary care, we've got breast health. We've got an entire panel of really amazing women physicians who've dedicated their lives really to the care of women.
Sure. What will they be speaking to? Is it going to be kind of along the same thread in terms of a theme? Are they speaking about the same issue, or is it across the board?
Kind of across the board.
Okay.
So each of us will be addressing the things that fall into our specialty area, and we'll be fielding questions from the audience, of course, everyone who signs on. So it's going to be really diverse. It's going to be very specific as well, and I think there's going to be a great opportunity to get your questions answered when you're out there and making the decisions for you and your family. I think it's going to be really powerful.
And in terms of this niche, right, this kind of women health, or female health care and everything, do you think that you guys are getting such a response from the community? Because it's something that has not really been as accessible in years past, and now there's a face, to put to you guys and really everything that you do across the board. Is it that accessibility that you think plays a big factor here in terms of it being as successful as you guys have seen it be?
I think accessibility is a big reason why it's really resonating. But the other thing that's really, I think, resonating and getting out there is that it's such a coordinated effort. Right? Before, I mean, there's been amazing healthcare in Cincinnati for a long time, but we really have a focused group of physicians at Christ Hospital specifically addressing women's issues.
Right.
And so it's really, it's been tried in other locations throughout the city over the years, but never in such a coordinated fashion where it's, as you say, it's just easy and accessible.
Yeah, absolutely. Why? Okay, if there's women at home who didn't know anything about this, they're just now hearing about it, why should they participate tomorrow? Why should they kind of start to get involved with the webinar tomorrow?
Well, there's going to be a lot of information just about health maintenance, right? There's so many screening exams that we should all be doing, from breast health to colon health to heart health, that we should all be aware of. Hopefully the women who join in and who watch will learn about when to get your colonoscopy, when to get your mammogram, why to get your mammogram, what are your risk factors for these various diseases. And so I think that everyone who tunes in or signs on will learn something.
Yeah, absolutely, because I just turned 36, and it's one of those ages where you start thinking, wait, do things change now? Do I have to go to different doctors now? Do I have to have different screenings now? So I think, again, the fact that you're able to approach it on this kind of level playing field, like you said, from 20s all the way up, there's no age limit really.
That's right.
And being able to embrace all sorts of, female-driven care. Where should people go in terms of the website and everything like that to find out more information?
So you can go to the Christ Hospital website, and there will be a link there where they can sign on. I think we've got something like 1,200 people registered for this webinar tomorrow, which is a little intimidating, but actually really exciting because wow, the enthusiasm and the interest. Do we expect all 1,200 to actually be able to make it? Probably not, but if we get even a half of that number of people, think about the impact on local families.
Incredible, incredible. Doctor, thank you so much, Dr. Rafferty, again with the Christ Hospital. We appreciate you for taking the time here with us today on Fox 19, and we'll have this information too on our website as well. Thank you again.
Appreciate you.